Good afternoon. And welcome to the August Medical Monday. How quickly this year is going. So today we have two speakers. We have Dr. Iorio.
Perfect.
I have to remember the Oreo cookies.
Easy to remember.
Of course, I'm going to add like food. So, and he's new to our the Reid team, and he is our newest hand surgeon. And following him, we have our community benefit spotlight. We have Misty Hollis from the YMCA, and you might see some things, though, some crosses and some other things on your table that she'll share that some of their students are participants at the YMCA. So, without further ado, Dr. Iorio.
That was good, thank you. Hi everybody, can you hear me okay?
No.
Right there? Check, 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 I always wanted to do that. In my second life, I was going to be a game show host, so we can work through this. So, thank you for having me today. This is very informal. I want it to be a dialogue more than anything, but my name's Dr. Tim Iorio. I'm an orthopedic hand surgeon. You might say, well, what's a hand surgeon? So a bit about me, I'm fellowship trained in hand surgery, but I'm orthopedic surgeon by initial training. So I went to medical school. I did a 5-year orthopedic surgery residency at Henry Ford in Detroit. I did a 1-year fellowship in hand and upper extremities, so from the fingertips to the shoulder in Philadelphia at the Philadelphia Hand Center. And then I've been in practice now approaching 13 years, primarily in Ohio. So it's a bit about me. So I just talked a little bit about what I treat, and then we can go into Q&A or however you guys want to do this. But I treat conditions ranging from the fingertips up to the shoulder, and that's a lot of issues, a lot. And some of you in this room maybe have dealt with issues or are currently dealing with issues that affect that. So you might ask, well, what kind of conditions could he treat? Well, it would take a while to list them all, but things such as nerve issues like carpal tunnel, cubital tunnel, trigger fingers, arthritis, lacerations, fractures, a whole host of things, ligament problems, tendon problems. It's quite a variety. So I really try to take care of the full spectrum of things. I'm really happy to be a part of the Reid community in Richmond and beyond. It really excites me. I found in my almost 13-year career that I treated patients from the suburbs, from the city, from rural community. I found that rural community there was something that really got me excited about the rural communities. So I'm really happy to be here. It's my second week, my second Monday here, so I'm still learning my way. So as much as I'm passionate about myself as a surgeon, I'm also a husband and have 3 wonderful children, 15, 13, and 11-year-olds. So I pride myself on that part of life as well. So it's busy, but we really enjoy it. So originally from Toledo, Ohio, so I'm an Ohio boy by heart, but my parents have a lake house up in Indiana, in Angola area. So I've been coming to Indiana for a long time since I was a boy. So I don't want to do all the talking, so it's a little bit about me. Do you guys have any questions? Nothing's off topic. I'm happy to answer. Yes, ma'am, right off the bat.
When we have an appointment with you, how do you start assessment or diagnosis for carpal tunnel?
Yes, ma'am.
That's my first thing.
Great question. So she asked about carpal tunnel, which I'd say as a hand surgeon is the most common thing I see and treat because it can affect nearly 10% of the population in their lifetime. That's a lot of people. So for me, first and foremost, regardless of the condition, it always starts with the history and physical examination. So when I say history, I ask questions about kind of what you're experiencing, your symptoms, et cetera, followed by the physical exam. So I actually see you, and there's some different testing I can do that way. It's interesting. Historically, surgeons who treat this would always get what's called a nerve test or an EMG. Have you ever heard of an EMG or a nerve test? How many of you have had one in this room? Yeah, pretty good number, almost half. So I don't routinely get an EMG. It depends on my confidence in the diagnosis based on the history and exam, but that's another test that can be done. But x-rays don't really have a role per se, MRI. So it's really history, exam, and possibly an EMG.
So the EMG is a type of test?
It's a good question. So the EMG is a nerve test. And I don't do the test. You're sent typically, neurology. So that's for another appointment. The neurologist, they do a series of things. I don't want to steal their thunder, but basically they test for the functionality of the nerve.
Does it hurt? Does
it hurt? I've never had it done to myself. I would say it's a variable. There are needles involved and a little electricity, so that's all I got. I don't do the tests, so I don't have to be the bad guy. But again, that's why I don't routinely get that also, because it's not absolutely necessary in all cases. So if I don't think it's necessary, then maybe I won't even order that. But if I need it, I would get it. So, so what is carpal tunnel syndrome? We'll go into that briefly. So there's 3 primary nerves that give sensation or feeling to your hand. And the carpal tunnel syndrome, it affects what's called the median nerve. So people with carpal tunnel syndrome have numbness, tingling in their thumb, index, middle, and part of your ring finger. How many people in this room have had carpal tunnel?
I haven't. Been diagnosed.
There we go. Usually by the time they come to see me, it awakens them from sleep, which is a common issue. And once something keeps you up from sleeping, that's usually kind of reason you see a doctor. I don't care what it is. And so usually first line of treatment for carpal tunnel is wear a wrist brace at night when you sleep. That can help quite a bit because a lot of people like to sleep in the fetal position. When you do that, it can put more pressure on the nerve. Other things that can help is a steroid injection, which I do, and then the surgery for this is quite effective. I'll leave it at that. But yeah, so that's carpal tunnel in a nutshell. Okay, let's keep this going. We're having fun. That's one of many things I can treat. So if someone has an idea, let's talk about thumb arthritis. Who here has pain in their thumbs? Grip strength issues. So I treat arthritis can affect any joint in the body, back, your knee, your hip. How many people have? But in the hand, wrist area, the most common reason people see someone like myself, a hand surgeon, is actually arthritis at the base of the thumb. Women more so than men. Upwards of 8 to 10% of women in their lifetime will have symptomatic arthritis in their thumbs. Probably because you guys work way harder than the guys do.
Well, I had a test, and it hurts.
The EMG?
It hurts.
There we go.
Okay. I mean, it hurts, y'all. It hurts. Anyway, I'm going to have surgery, and they said it won't help. That's what they said.
Okay.
And I didn't do it. So.
Come see me sometime. We'll talk.
Okay. No, don't give me the test again.
So back to the thumb arthritis. So again, most common issue, again, I see, if I was going to give the broad category, women more so than men, 40s is on the young, but 50s, 60s and beyond, base of the thumb, difficult time turning, gripping, twisting, gardening, all those basic things, a lot of pain here. So typically for that history exam, I can usually diagnose that from the doorway. And then testing, I usually just need x-rays and that'll show the arthritis. And then treatment for that can be very effective. Use of a certain type of splint, which I can give you more info about. Steroid shots can help intermittently. And then there's a surgical option as well that's actually quite effective for that. So I think we all have to realize that a lot of these issues you may be dealing with may be treatable and fixable. So don't just sit and feel like you have to just be miserable with them. There's a lot of ways we can treat a lot of these things. Yes, ma'am, we got one.
What about neuropathy in your hands? Neuropathy, is that what you pronounce it?
Neuropathy?
Yes.
So neuropathy in the hands or neuropathy is a very broad category. So typically neuropathy can be due to something like diabetes, which is more of a medical treatment. I can't really treat neuropathy per se. Technically, there's something like carpal tunnel where you have a pinched nerve. That's called a compression neuropathy, meaning compression, there's pressure on the nerve. That's something I treat. Or something, has anyone ever heard of cubital tunnel syndrome or ulnar neuropathy? Anyone ever heard of that? So that's a pinching of the ulnar nerve, the funny bone nerve here at the elbow. That gives numbness and tingling in the ring and the small fingers. Anyone ever have that before? Yeah. So that's compression neuropathy. But neuropathy is just a very general, broad medical diagnosis, which there could be a lot of causes. Again, if it's, say, due to diabetes, medical control of diabetes is going to be your best approach for that, for sure. All right, now we got them coming. I like it.
Okay, so I have numbness and tingling in my little finger.
Okay.
It's all the time.
All the time. It doesn't come and go. It's constant.
Yeah.
Does that wake you up from sleep?
Not really.
Don't sleep? Well, that's a problem, too. Whoa. Are you losing strength?
Do I what?
Are you losing any strength?
I don't think so.
So what I will caution, again, I'd have to see you, examine you, et cetera, but another
All the time, though.
another cause, so that could be that ulnar neuropathy at the funny bone nerve. Another thing that I always have to think about is actually neck problems. So there's nerves that come out of your neck, but then they kind of work your way down your arms into your hands. So it's not uncommon for me to see someone as the hand surgeon for a presumed upper extremity issue, and then I do my history and exam and determine that it's actually coming from your neck. So again, common things are common. It's probably one of those two things if I had to guess. Yeah, gotcha.
I don't think I need the mic.
No.
If you go to the doctor because you've got arthritis in your hand, I ain't saying it for me. But when you go there, the doctor says, I can put some pins in your fingers, but you won't be able to bend them. Why would you do that?
Good question. Arthritis in your hands, pins in the fingers. So I'll give a broad understanding of arthritis occurs in hands. All those little joints in your hands can get arthritis at some point. In fact, I'm sure it's the joys of getting older, wear and tear. And there's also different types of arthritis. There's osteoarthritis is the most common by far. That's just the joys of getting older, wear and tear arthritis. Then there's some other types called rheumatoid arthritis, which tends to be more of both can be inherited, but that tends to be a more inflammatory arthritis. Tends to show up much younger in age. So again, without going too far into the treatment, when you look at treatment for hand arthritis, it's tricky because you can't really cure arthritis, right? I'm sure you've heard that from a doctor if you've ever seen someone for arthritis. It's not curable. So for hand arthritis, there's a bunch of different conservative things I can offer. Once in a blue moon, it's very rare, but the fingertips, it's called the DIP joint, so your fingertip, that's a certain joint. For people, and I've only had to do it a couple times, but it's for those who are quite miserable. The treatment, the surgical option for that is to actually fuse the joint so yeah, it doesn't bend. You know how like if you have really bad back arthritis, what do? Fuse your back? Well, the same thing applies, but you could also do it for other joints of the finger, but again, that's kind of last resort. And people that get to that point are quite miserable. They'd rather lose a little bit of range of motion than have the pain that they're having. So, but that's a good question. Yes, ma'am.
Can we get to the elbows?
Yeah, go ahead. Hey, bounce around. You guys are going to really test me today. I feel like I'm in office right now. Let's go.
Physical therapy for that, what do you call that?
Tennis elbow.
Well, yeah, but now I have bone on bone.
Oh.
Okay.
You got elbow arthritis. Ooh.
Yeah, and I'm starting to get it on this.
Do you really?
Yeah.
Okay. You want to talk about that?
Can you operate on those?
Well, let's talk. So she asked an interesting question, elbow arthritis. So again, arthritis can affect every joint in the human body, so no joints off limits. So a couple things about elbow arthritis that you mentioned. First of all, it's pretty rare. Primary arthritis of the elbow is not common because we don't walk in our hands, so it's like not a place you see it a lot. Sometimes it can be due to, again, that rheumatoid arthritis that we talked about, but if you had rheumatoid arthritis, you'd probably know by now. But you can get bone-on-bone osteoarthritis just by the joys of getting older. Typically for that, I would try a steroid shot first into the joint. Have you ever had that done?
Yeah.
By who? Yeah.
I'm pretty good with it because I stretch, do other exercises. She's always working.
But believe it or not, surgery for elbow arthritis is not very common. I mean, there's pretty strict reasons. I mean, again, like for example, we talk about joint replacements, right? Hip and knee replacements are two of the most common surgeries in the United States. Elbow replacements are exceptionally uncommon. One reason being, if you were to ever have something like that done, you're looking at a 5-pound lifting restriction for life. Not a lot of people are signing up for that. So we tend to, just to get one last thing about elbow replacement, we tend to reserve that for either someone who is much older and less active than you who are just miserable, or with very bad traumatic injuries, bone fractures, those kind of things where you just can't fix it. But elbow replacements are not very common. Ma'am.
Well, I want to let everybody know if you're doing yoga and you do upward facing dog, make sure you're doing it correctly, because I think that's how I got it.
I'll tell you this though, because we're talking a lot about arthritis. I had a patient a couple weeks ago, he's in his mid-80s, active as can be. He gave me one of the best lines I use all day, every day. Doc, I would rather wear out than rust out. Stay active. I don't care what you have going on. You gotta keep moving, wear out, don't rust out. If you're wearing out, that's why the orthopedic surgeons exist, to help you through the wear out process. If you rust out, if you're sitting around, if you're not active, that's not good for any condition. I don't care if you have lower back pain, laying around is not good for that. If you have knee pain, you gotta stay active. And if there's something keeping you from being active, that's where we come into play. And we can't make you 25 again sometimes. I mean, I wish we could. I wish I was 25 sometimes, but like, you know, you have to have realistic expectations, but keep wearing out, don't rust out. Yes, ma'am.
Oh, I can talk loud.
Okay, so can I.
My sister got her hand hurt in an industrial accident years ago,
Okay.
and it's just killing her now. Morning, noon, and night, her hand hurt. Is there anything you can give her other than pain pills because they upset her stomach?
That's a loaded question, an issue. I'd have to probably know more about the story, but I wonder, did she have nerve damage? Is that what they told her?
She lost 3 fingers and a thumb.
Oof.
All she had was this.
Yikes.
And then they took her toe off trying to make her.
Yeah, no, I'm familiar with that. So, yeah, it's a complicated story. I don't want to go too, that's kind of, I would say it's not in the realm of like common conditions. That's tough. There aren't a lot of great pills for that or treatments for that, but ouch, that's a tough one. Unfortunately, I've seen those types of patients in my career. Those are pretty rough to see, for sure. I don't have much more to add today, though. Sorry about that. Ma'am.
What's the difference between a steroid shot and a cortisone shot?
Great question. Difference between steroid shot, cortisone shot, nothing. It's the same thing.
Because I've had cortisone in my ankle.
Okay.
But they're only like, what, 3 months?
So the question, she had another great question. How often can you get steroid shots or cortisone injections? So none of those are like straightforward. It's really based on whoever's providing the injection has their own different philosophy. I would say in my practice, and I inject a lot of different things. I mean, you kind of name it in upper extremity, I've probably injected it. 3 months I'd say is a pretty marginal response. 6 months or longer. Unfortunately, you kind of don't know how long it's going to last until you do it. But and for certain conditions, we can do more injections than others, but that's a whole nother it kind of depends on the specific condition. So, for example, like something called trigger finger. Have you guys ever heard of a trigger finger, trick finger? Who's had one? Not that many. Wow, I'm surprised. There you go. For like a trigger finger, I'll do like 3 injections max. But again, I won't go bore you with all that. But it's not exactly just straightforward. It's kind of different for different things.
Because I've already had carpal tunnel surgery on my right hand.
Yeah.
The day I had surgery, the pain went away.
Great.
But I suffered for 2 years.
Yeah.
But they want to do it on my left. And I wear the brace because he wanted to do surgery immediately. But I said, no, let's do the braces. But I was just wondering about the cortisone, because
it's an option.
Get cut on. I mean, I get shot.
Well, I will say with carpal tunnel, kind of the way I approach it, the steroid shots can help for a period of time. They tend to not be a permanent solution. Whereas by and large, again, I like to under-promise, over-deliver, but the surgery, by and large, if done well, it tends to be the permanent solution. So it's all about how you're wired. Some people don't want to mess around with shots. It works for 6 months, and it takes a month to get back and see the doc because he's so busy, and then you're suffering. Some people just want to be done with it. So, and the surgery for a lot of these issues, and that's a whole other talk. We've come a long way. I like to think that I really try to, minimally invasive is something that's thrown around, but I really understand the impact of not having full use of your thumb or your hand or your arm. So I really try to get people going and back as soon as safely possible. So, yes, ma'am. Mike or no Mike?
You said don't sleep in a fetal position, so we should sleep with our hands flat as much as
So I spoke about that a little bit. So with people that have carpal tunnel syndrome, many of us like to sleep kind of subconsciously in the fetal position, right, curled up. And when you do that, if your wrist is flexed or extended, it puts more pressure on the nerve. So obviously when you're sleeping, you don't know what you're doing, but the goal of a wrist brace is to keep your wrist more in a neutral position so you're not sleeping like this or like this.
There's arthritis gloves you can buy.
Yes.
Are those helpful?
So arthritis gloves, I like to give, whenever I see someone for hand arthritis, which is generalized, that is one thing that I do recommend, arthritis gloves, especially up here in the Midwest. I tend to find that the winter is pretty miserable for a lot of people with arthritis. So the goal is heat. I find the heat of any form really helps arthritis. So arthritis gloves, yes, is a good thing. And no, I have no preference. You can go online or however you like to shop. There's a million different types. You just find one that fits you and that seems like a reasonable price, and I'd go with that. Yeah, they can help. Heat also can help a lot, like something called a paraffin wax bath. Has anyone ever had paraffin before? So something you can actually, again, order those. You can order anything online nowadays, but you dip your hand in like warm wax, and that can help, especially in the morning. Most people with arthritis in their hands are worse in the morning, so you can kind of do that in the morning. That can help a lot. And again, we want to. What's the theme here? We want to wear out, not rust out. So we got to keep moving. I see people all the time. My finger hurts. I don't want to move it. Well, if you don't move it, it's not going to move. So you got to keep moving, even if it hurts. Don't ever stop moving. From your fingers to your shoulder, don't stop moving. Easy to get stiff, very hard to unstiffen. So don't stop moving. But if it hurts so badly you can't move, that's when you really should be seeing someone like me, a specialist, so we can get you figure out why you're having so much pain. But the worst thing you do, I'll talk about the shoulder briefly. Someone will come in, the shoulder's been bothering them. How many of you have had shoulder pain? Yeah, the number's starting to up. I have myself. I mean, so, doc, it hurt. So for the last month, 6 weeks, I wore a sling, or I didn't move my shoulder at all. Next thing you know, they come in and this is all they can do because they got what's called a frozen shoulder. That's kind of a nightmare. I mean, has anyone ever had a frozen shoulder? That's a horrible thing. And it's not an easy thing to get better. So don't stop moving. What else we got? Ma'am.
Okay, so occasionally my finger will do that. Is that actually considered trigger?
Probably a trigger finger. Trigger finger. Yeah.
Happening down here at this joint.
Yeah, painful right there. Yeah. So a trigger finger. A bit about that. That's another as a hand surgeon, the second most common thing I treat next to carpal tunnel. So trigger finger. The analogy I like to use for trigger finger. Think about your finger as like a fishing rod. Okay. The rod are the bones and the joints of the finger. There's a series of loops in the finger on the underside of the palmar side, and the fishing line are the tendons that flex your fingers. For whatever reason, it tends to be like a tendonitis issue. Those tendons get swollen, and it's like having a big knot in your fishing line, so it doesn't pass smoothly. When it gets like hers, where it starts locking, then you have to unlock it. So very treatable. There's only really two ways that effectively treat that. Steroid injection can help tremendously. Surgery can definitely fix that too. So, boom, boom. Ma'am.
On the trigger finger.
Yeah.
Can that go away on its own?
I think it probably can. I just don't see the ones that go away.
Right. Because I thought I had it at one time.
Yeah.
I had the knot there.
Yeah.
And it's not there anymore.
Yeah, I do believe, because we believe it, well, not just believe, we know it's a tendonitis. So if that inflammation calms down, then maybe it's not so painful and the swelling goes down, then it moves smoothly. But yeah, I think it can go away.
If I was wrong or not.
No, you're probably right. I think it can go away, yes. But again, I see the ones that don't go away. So, ma'am.
My husband's resolved on its own.
There you go.
And he had it several years, and then
One day.
eventually it went away. Wow.
Yeah.
Now that I have your attention.
Yeah. I would say that's probably the exception, not the norm, but hey, that's good.
Many years ago, I had a ganglion on
Yes.
the base of my middle finger.
Sure.
And I played, and I was hanging from a plate. I was at the playground, and my weight, it popped.
Popped.
I thought my hand exploded.
Yeah.
And the ganglion was gone.
That's a good tangent. So lumps and bumps in the hand and wrist, very common, very, 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 very common. The most common is called a ganglion cyst. The analogy I like to use is like a water balloon. So that benign cyst is never cancerous. It usually attaches to a joint or to a tendon. And I like to use that analogy of a water balloon because it makes intuitive sense to me. So what probably happened to you is that balloon popped and the fluid rushed out. And they used to call them Bible cysts. You know why? And we're in a church, so we can say this. Smack with the Bible, yeah. So, if you want to do that, go for it. I mean, just don't break your hand because you got a different problem. Massage, yeah. But for cysts, for again, if you're not sure, not everything's a ganglion cyst, so certainly that requires a little bit more expertise. But history, for me, a history and exam, typically I'll get x-rays and then discuss treatment. Sometimes, again, a steroid shot can help. Sometimes surgery to remove it, sometimes just keep an eye on it, those kind of things, yeah. Rarely, the good news is very, 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 very rarely is a lump or bump of the hand, wrist, cancer or malignant. Typically it's benign, so. Yes, ma'am.
Last thing for me.
Keep it coming, that's good.
If it's your hand or fingers, but then you have something that might be with the shoulder and the neck, do you do all of that, or do you have to see different people?
Good question. I certainly will treat whatever makes sense for me to treat that's really within my expertise. If I find, for example, you have a neck issue, we have fabulous doctors and APPs at Reid that take care of neck issues primarily, so I would refer you accordingly. But I usually would at least start the workup or the discussion. I feel like I'm pretty good at this point after all these years of determining if it's neck. And sometimes it's more than one thing, right? It's not always just one. I mean, I'll see patients who they have a pinched nerve in their neck, and then they also have a pinched nerve downstream at their carpal tunnel. Well, we call it the double crush. We're always trained, and I've done this, where take care of the downstream issue of the hand, because that's much more straightforward. And if it resolves everything, then you don't have to worry about your neck, because the neck can be a different animal sometimes. So, but yeah, I can usually pick that up pretty well.
Massaging?
Can't hurt.
But it's not like the best.
It can't hurt. I know what I know. I don't know what I don't know. I mean, there's certain things that people try, and they swear by this different lotion or potion. I say, hey, as long as you're not hurting yourself, go for it. And it's not like you're not breaking the bank. But all I can give you is what I know based on experience and literature, et cetera. But, massage never hurt anyone. I need a massage. Chiropractor? Ooh. Yeah, that's probably, it really depends on what the condition is, I would say. And the chiropractor, the manipulate, yeah. I don't have much to say other than that they can be an option. They can be an option, certainly. Yes, ma'am.
Is there a general exercise for shoulders that are sore, achy?
Great question. I would say if you have any access to like the internet, just look up like rotator cuff exercises, and that alone can encompass a lot of things, and that can help a lot of issues. Rotator cuff. Some call it rotor cuff, but rotator cuff. Yeah. And really, those are the muscles and tendons that do rotate your shoulder. So if you just did those, and I usually advise patients to go online and just look up, Mayo Clinic. I don't know if Reid has, I don't know, Monica, if we have access to that somewhere here, but there's educational things all over the place. Go to ChatGPT. You probably don't know what that is, maybe. Does anyone know AI? But anyway, you can find just exercises, videos, and I think that's good. You want to wear out, don't rust out. And I would say if you're going to see someone for your shoulder, that'd probably be a good place to start. If you're hurting, start doing some of those types of exercises and anti-inflammatory, see if that helps. And if it doesn't, then you should probably kind of progress up the treatment. Because again, a steroid injection can help a lot of shoulder issues as well.
Stand up and say you. Several of us go to Silver Sneakers several times a week.
Yes.
Lots of classes, so
That's great.
look them up.
That's wonderful.
Instructors.
There we go. Plug for Silver Sneakers. There we go.
We'll wear you out.
But I believe I love it. It's great. Because it's funny, I talk to my parents a lot. They're in a similar age group, and they just talk about how they're retired, they stay active all day, every day, mentally and physically. So important. So important. No matter what, my dad likes to go to the library and read and just keep, learn about new topics. It's just it's vital. Because I'm at the Reid Comprehensive Orthopedic Center. Monica can tell you more. Yeah.
The easiest.
Yeah.
We are located behind Frickers, 1400 Highland, right by 70. In that building. We have orthopedics, spine, pain management, span surgeon, podiatry, walk-in clinic that's open Monday through Friday, 8 to 8. So a lot of great things in the building.
For sure. Definitely. Thanks, Monica. Yeah, I'm fairly new.
Yes, yep.
Yes. But it's really impressive. Great group of people. I've been very impressed. So we kind of cover virtually all the bases. So if you need help, there's someone there to help you for sure. Do you know, Monica, do they need a referral from their primary care to see us? Nope.
Most insurances do not.
So no referral necessary to see us. And I am a surgeon, but I'm happy to see people that are non-surgical. So don't feel like, oh, I'm not sure if I have a surgical problem or not. I don't want to waste his time. It doesn't waste my time. If I can make you better, I try to avoid surgery when I can. If I can make you better with non-surgical options, I will do that my best. But I also can do a lot of different surgical things if we ever have to get there. But like, that's not the first route for all this stuff. That's kind of like the last resort for a lot of things. Now, if you break your wrist really badly, that we might not have as many options. But for some of these things, I'll give you what I've found to be effective, and then we just kind of go from there. So, ma'am.
Since neuropathy is the nerves, am I correct to assume that steroids will not help?
Again, neuropathy is kind of a generalized thing. It depends what's causing neuropathy. But if we're talking about the compression neuropathy, which is my expertise, carpal tunnel, cubital tunnel, oral steroids can help a bit. Not long term, they can help a bit. My one caution to you about that as well is if you're really dealing with nerve issues that seem to get more severe, more constant, etc., you're really going to want to be checked out sooner as opposed to later, because what can happen is the longer that goes on, it can start doing more and more damage internally to the nerve, which makes some of the treatments that I could offer less effective. So like anything, the more severe it is going in, the harder it is to get it better coming out. So if you're noticing worsening numbness, tingling, strength, weakness, etc., waking up from sleep, you're not going to want to just sit and ignore it for long. I mean, I'm not saying 1 day or 1 week, but if this goes on weeks, months, you definitely are going to want to get checked out for sure. But with neuropathy, when you think about nerves being affected, there's stuff that can occur within the nerve, that's neuropathy, and then stuff outside the nerve like compression. So my specialty is the compression component of it, so yeah. Yes, ma'am.
About to wrap up this.
Yeah.
Can you tell them about the walk-in clinic or
Monica?
So like I mentioned, we have an orthopedic walk-in clinic, so it's open Monday through Friday, 8 to 8, no appointment necessary, no referral. So you can walk right in, get checked in, and be seen. We usually have 1 or 2 providers, 2 most of the time over there, so the wait is not exceptionally long. The beautiful part of what we do, and I love that we've been doing, is if you come in and they determine it could be a neck or a back problem or a foot problem, and one of our spine surgeons or podiatrists have a spot available, then they'll go ahead and let you see them the first time. So that way you're seeing our hand, like Dr. Iorio's here now, so if we think it's a hand issue and he has availability on his schedule, then we'll put you on with him. That way you see the right specialist the first time and not have to go and then see them again on another appointment once they start. But either way, when you come in, they can start getting your x-rays, do a physical exam, see if you need x-rays, see if you need an MRI, see if you need the hand surgeon. So that's a really great part about our walk-in. It's been there for 4 years in July, so they had their busiest month in July, so that was exciting. So anyway, great providers, great staff. We have x-ray on staff, so you can get your x-rays right when you're there in the building. 3 x-ray rooms, great x-ray techs. So yeah, a lot of great services. I feel like we could take care of you right the first time you walk in. So
that's great.
So you don't need to be referred by your family physician?
You do not. There are very few insurances that require that. It would be like if you're a VA patient, you need to get approval from the VA. Really work comp, you might have to have some kind of authorization first, but most 99.9% of people do not have referral. See a specialist anymore.
Okay. Yeah. So that's one less deal.
Yeah. I'm going to go ahead and wrap it up here a bit, but I'll tell you, Monica alluded, it is a fabulous setup. To be able to walk in and potentially see these specialists, that's fantastic. That's a very cutting edge approach, which I also think is great. It's great. And also, I work in conjunction with a physician assistant PA named Matt, who's also very experienced, knowledgeable. So again, if you come to see us at the walk-in clinic or to our office, there'll be someone there for you for sure. So I don't want to take up any more time, but I really appreciate your your attention, and it was really fun. And again, if you ever need to see me or nothing's too trivial, I'm happy to see you anytime. Okay?
Before you quit, can I ask you a question? It's short. Carolyn said there's a certain stage in your life when you get too old to do anything for it. Is that true?
Oof. Yeah, I have a strict, Monica, what's our age cutoff again? Yeah. Well, I have to preface that. Are you nice or are you not nice? If you're not a nice person, then the cutoff is much younger. No, but I'll tell you, what I'm amazed by during all this time is like the patients in their 70s and 80s beyond how active people are these days. Age to me is just a number, it's a state of mind. So I don't want you to think, I've seen people in their mid-80s doing things that blew my mind. And I think 60 is the new 40. So with that being said, there's no age cutoff, but if you're really nice, that cutoff gets much, much, much older. All right, thank you, thanks. Thanks, Jared.
For our community spotlight today, we have Misty Hollis with the YMCA. Good afternoon, it's so good to be with you, and I know we're getting close on time, so I want to take about 10 minutes and just share with you some updates about the community YMCA. I see some familiar faces in here. Apparently you're the new 40, so congratulations, we just heard today. I'm telling you, I'm not feeling it. So I hope you are. My takeaways today, I always like to leave something with a takeaway. So here's my takeaway for the day. He talked about, I want to help you to help you get through the joys of getting older. I had thought about it, about being joyful. So as I walk down this path with you, we'll talk about it. Then Miss Cindy over here talked about doing the upward facing dog correctly. Dear child, I don't even know if I could get up from doing the upward facing dog. Oh my goodness, and wear out and not rest out. So there's my 3 takeaways today. I'm so happy to be with you. I just want to share a little bit. The YMCA here was founded in 1907. We are the longest serving youth organization in Wayne County now. After Warrenly closed, Warrenly had us beat, and then after they closed, we're now there. Our mission is still the same, and I put brochures on the table for you to put Christian principles into practice through programs that build a strong spirit, mind, and body for all. That's a mission that's been in place since our inception. For us, what that looks like is we don't talk about Christian principles and everything we do. It's more act it out and make sure that we are showing the examples, and our volunteers are showing good examples from that standpoint. We do have a faith-based committee that meets regularly. We do have Bible study at the Y. We also have a Good Friday breakfast. So there's things that we do. And on your tables, and I don't know if every table got some, but our after-school childcare kids, they like to take crosses, and we give them crosses, and they design and draw on those crosses. Those are your gifts. If you'd like to take one, those are gifts from our kids to you. We're very blessed that we serve about 250 kids in daycare and in childcare. So, and then I just put on the table some pictures for you to see of some of our sports kids and the volunteers with our kids, and so you can just see how happy some of them are, and then on picture day you have kids that aren't so happy, and you might have some of those at your table. Those are my favorite moments, actually, when kids are screaming. So in the brochure, I just want to highlight a few things. The YMCA, when it started, was really, it started in England, and the inception and the concept was to help veterans. Veterans have a healthy place to come, to have a place to sleep. If those of you might be old enough in the room, at the Y, you would have a room. You could stay at the Y. And so that was really the inception. Over time, and quickly actually, the founder of the Y realized that being healthy actually helped your mindset. And so that meant exercise, doing things with your body, the moving, not wearing out, not resting out part. So that got added to the element of the YMCA quickly. And then it just kind of was a firestorm and came over here to America. So we still have that component of the healthy side. Our YMCA is located in the old T.R. Richardson building, We share it with Excel Center. It's a very small facility, very family oriented. People that come into our facility, we know their stories. We know if things are going well, if things are not going so well, and that's a part of our culture that we like at our Y. And we serve kids at that location from 3 all the way up to, I think our oldest member is 90. And it's amazing how that 90-year-old still is active and comes in every day. So that is still there. And then the other part that has really taken off for us in the community is after-school care and daycare. We did an assessment about 3 years ago, and we found out that the need of child care was just exploding. A lot of families, both parents are working, or they're single parent homes, and so we have families that need that assistance with their children while they're working. So we did some research and found out over in Cambridge City, they call it a child care desert. There was not a licensed daycare in Cambridge City. And so we opened one right after COVID. We have a wonderful partnership with the elementary building. We are actually the second site in the state of Indiana that has a daycare inside the elementary building. And it's a great partnership for us. So we have a licensed facility there, and then last year, November, we opened up a facility at Trinity Lutheran Church, which is the west side of town. It's across from the radio station. And we opened up a daycare there. We've been open since December. Still have spots there. Cambridge City is full and has a wait list, but the Richmond site, we still have a few spots. Then for the after-school care, and what is the difference between, why is that important? Well, for the after-school care, we're licensed. So we have to follow the protocol, the expectations, the licensing standards that the state of Indiana put forth. So for every one of our sites, our staff goes through a very strenuous background check, drug screening, training, our ratios. We have, for at the school age, it's 1 to 15 kids, 1 adult to 15 children. For infants, it's 1 adult to 4. And some days that is not enough, I can tell you. When we got 8 of them screaming and there's only 2 of you, that's not enough. But we make it work. So we have expanded quite a bit. We have after-school care. We do morning care at Northeastern Elementary, so kids are dropped off before school. We do after-school there at Northeastern. Charles Elementary, now that serves all of Richmond schools, but that's where our primary location is for Richmond. And then Liberty at the elementary school there, we have after-school care there too. They don't have access, there's not a licensed facility there as well. So we're doing what we can to support our friends and fellow members down there. And then the last thing I just want to say is that we still do sports. We have about 600 kids that go through our sports every year. And I was asked recently, is that a duplicative number or an individual? In other words, we're counting a child one time. So that's a lot of kids that we put through our sports. We're very blessed. This is purely volunteers. Every person that coaches is a volunteer. And we are so blessed to have so many volunteers that are willing to give their time to kids. And in that list, you'll see fall and spring volleyball, fall and spring soccer, indoor soccer, basketball, t-ball, flag football, and track and field. We would love to keep adding sports, and we'll do our best to do that. It's on demand. Right now, we have soccer and volleyball. As you're walking out, if you have a grandchild or a child, that there's registration forms out there as well for you. Where are we going next? Well, frankly, we have another school corporation that's asked us to look at after-school care for their site. That would be one more site for us to look at. I'm a little hesitant to add another site, but we'll do what we can to meet the need. And then we are about to do some more renovation inside of our building and become a 24-hour access at the YMCA for our members. So that is a little leap. We don't own the building, so there's a lot of compromising and conversations we've had to do with our landlord, but we're working through that and we'll move forward. I also out there, just for your information, we do highlight a lot. We have senior classes, fitness classes. Cindy used to be one of our instructors for young Pilates. But at the 10 o'clock, 9 o'clock, and 10 o'clock mark, we do have silver sneakers classes and other senior classes. And I put the class schedule out there for you to check as well. I have like 1 or 2 minutes for questions if you have any.
What'd you say about Warrenly Home?
Oh, Warrenly closed.
Yeah.
Yeah, they closed. And they were the oldest youth serving organization before they closed in Wayne County.
So what's in there?
A day mark, it's, I don't even know if they're open yet, but special needs. They're autistic, Down syndrome, special needs will be going to that location. So Daymark bought it. Yes, ma'am.
Are you currently hiring for any part-time childcare at any
We
of your
are. Our
facilities?
west side, we actually just had somebody leave us Friday, so we are looking for part-time on the west side.
Okay.
Absolutely.
Okay.
That's one spot.
Not
Yes,
for
ma'am.
me. Eligibility for the daycare.
Yes. So we are like eligibility for free
How-
or assistance.
Whatever,
Whatever
is
we
it
have.
income based?
We do, so the YMCA does offer, when we do fundraisers, our Christmas tree sales, our golf marathon, our Good Friday breakfast, those are fundraisers that help fund our scholarship assistance. So we do have a process for families if they need to fill out a scholarship, and it's based on a sliding fee scale on income, expenses, how many kids are in the home. But we do offer assistance, yes.
Do you take the vouchers that they?
We do not take vouchers. We use our scholarship assistance in the place of the vouchers. Any other questions? Yes, ma'am.
Is that free, for that calendar with the activities, is that sign up free, or do you have to become a member of the Y?
You have to be a member of the Y, but we, so there's, I'll share that with you afterwards, but there are age groups that have different price ranges. Yeah, we go from older adults.
If you're a silver sneaker,
It's free, that is correct. If you have, if you want to check your insurance, supplemental insurance that you have, we carry 3 insurance providers that will pay for your membership. And Silver Sneakers is one of those that we take.
Well, for that aftercare, they take after-school daycare, how do they get there from school?
So Northeastern Elementary is in the building. They never leave, so they just stay with us. With Charles, their bus there, Richmond Schools will bus the kids from wherever building they are. At Liberty, we have kids at College Corner, and they are bused to the Liberty site. So it's all done on busing. And one more question. Yes?
With the focus that you were speaking, let me just stand up so I can project. With the focus that you were speaking about,
yes.
It sounds like we're going with the youth more than maybe the seniors. So I'm asking, do you still do Zumba?
Yes.
You do Zumba, okay, and is there a swimming pool?
There is not a swimming pool. The only swimming pool in Richmond, indoor swimming pool in Richmond, is at Irwin.
And
Yeah.
then, last question, is there any program just for seniors that's, I haven't seen the schedule?
Yeah, when you see the schedule, it's Monday,
see that.
Tuesday, Wednesday, Thursday.
Okay,
Yeah,
thank you.
just for seniors. All right, turn this over to you. Thank y'all so much. Thank you.
We want to thank you for joining us today, and hopefully we'll see you next month.
Thank you.